Thank you. Good morning, everyone. I'd like to call the Audit and Control Committee meeting to order, September 21st, 2023. If everybody's had an opportunity to read the minutes from the last meeting, I'd entertain a motion to approve those minutes.
I'll make that motion.
Second.
All those in favor, please say aye.
Aye.
Opposed? Carried. Thank you. Privilege of the floor. Is there anyone here today to speak to the privilege of the floor? Please, yes. For the committees, we have everyone come right down front. So I apologize, but we want to be focused and listen. And you can sit right in front of us. Just please introduce yourself. You know the drill, and you have our ears.
Okay. Hi, my name is Ida Golden. I'm a Chautauqua County resident. And I'm here today because last night I watched the health committee meeting and I was pretty disturbed about what I heard. All right, so I'm here speaking on behalf about proposal number 11 on your agenda. Authorize acceptance of aging and disability vaccination cooperative funding for Chautauqua County. Some of you may not know about this already because maybe it's the first time you're hearing about it. So this is the $286,000 grant. It will incentivize COVID and flu shots against minority populations of all ages. 2,500 shots is the goal, coercing people with $25 gift cards to local businesses. I had hoped that the health committee body would have recognized this resolution for its ethical void. The committee acknowledged that people can get these shots for free if they wanted them, and $25 may be the push needed for low-income people to do the right thing. One legislator remarked, "Whatever works." Using coercion, targeting the needs of individuals is a total disregard for their dignity. The health networks will be targeting, their words, disabled and minority populations. These are known low-income groups. They mentioned that Chautauqua Center believes coercion would tip the scales for this segment of the population to get vaxxed. Besides the ethical aspects of this resolution, it's a horrible waste of money. We are a nation with $33 trillion in debt. By voting for this resolution such as this one, you will be contributing to that debt. If people want those shots, they would have gotten them, and it is past time this spending spree ends. I don't know how it's legal to coerce vulnerable individuals. And other issue is, how are they determining where these gift cards come from? What safeguards will be in place against kickbacks and money laundering? And that's what I have to say today.
Thank you.
I hope that you consider this, and by not voting this resolution through, the spending has to end. It just needs to end. Thank you.
Thank you. Any others to speak to the privilege of the floor this morning? Not seeing any more. We'll move into our proposed resolutions. The first resolution is to authorize the purchase of real property in the town of Chautauqua.
Good morning.
Good morning. Okay, thank you.
Thank you.
Pierre is the other one. He's our other he makes a quorum this morning. And for those anyone is just for business or official business, we do have a quorum. Pierre is here this morning and is a voting member. So we have Pierre, Mr. Wilfong,
There you go.
and myself. So thank you.
Good morning.
Good
My name
morning.
is Tom Walsh. I'm the director of the South and Center Sewer District. This resolution is to purchase property in the town of Chautauqua. Christy, do you want to mention the typo on 2027?
No, I've already corrected that.
That's okay. Thank you. So what you're looking at is a map of phase 2 of the South and Center Sewer Extension. This is on the west side of the Chautauqua Lake along Route 394. The outline is phase 2. And the arrow depicting the location of the proposed property purchase is to the right. Currently, the engineers are 80% through design. This location was picked, this area actually was picked, and this was the number 1 location that they had chosen. We reached out to the property owner, explained to her that we would like to purchase the piece of property outlined and install a pump station. The pump station is actually to the lower right, and that is the Hadley Bay pump station that has been currently installed in phase 1 of our sewer extension. We contacted the property owner. She was very understanding of who we were and what we were doing. We explained that she could look at that pump station. That's what she would be looking at on that corner piece of property. We asked her if she would sell the piece of property. She would. She offered the cost of $9,500. We came back with $7,500. She accepted that. So currently we are in the process to purchase that for one of our main trunk line pump stations.
Questions, comments? I'm okay with it. I think it's
Pierre knows a little bit about it.
I serve on the sewer board, so I'm very familiar with this, and this is an absolutely perfect location for the pump station. And in terms of the total collection and transmission system, but also in terms of ease of access, it's ideal. So we're delighted to have the opportunity to complete this acquisition.
sounds like a fair transaction. Sometimes people can name a price for sometimes that has out of convenience. So it sounds like the lady's been very fair.
No, she's in favor of the whole project, but if she's going to look at it, she wants to be compensated. So
Understood. So
and the property has been in her family since 1968, so it's quite personal to her. So
sure. So
Yeah.
we want to thank her for doing this also. So all those in favor, please say aye.
Aye.
Opposed? Carried. Thank you.
thank you.
Next proposed resolution is authorized agreement with County of Cattaraugus to extend the term of the Conowanga Watershed Commission. Good morning.
Tim Carr, Director of Public Facilities. Good morning. Drew Rogers, Deputy Director of Public Facilities Engineering. This resolution is to continue the agreement with Cattaraugus County to extend the term of the Conowanga Watershed Commission. The Conowanga Watershed Commission is made up of members from both Chautauqua and Cattaraugus counties, and they're responsible for the maintenance and operation of the flood control structures in the Conowanga watershed. They also oversee the maintenance of what's referred to as the dredge, which is also part of the Conowanga Creek watershed flood control. Part of this is to also continue the annual allotment of $7,500 per year to the commission, which each county pays the equal share.
Drew, this money's already budgeted.
Yes.
Drew, a little bit off topic, but I just learned yesterday at the Soil and Water Conservation District meeting that the maintenance of these flood control structures that we have allocated ARPA funding for a long time ago in the hopes that that long overdue maintenance would get done this year is likely not to get done this year. That's very disappointing and a bit concerning. So could you speak to that, please?
Yeah. We are about 99% complete with the design. Everything's been permitted. We did get behind a little bit with the design, and still hoping not hoping. The plan would be to get it bid again this year, if the contractor so chooses to do frozen groundwork. I'd like to still get started, but in all likelihood, it will be a 2024 project.
Well, we would like to encourage frozen groundwork if necessary to
Correct.
get it done,
Yes.
because the condition of those are very disturbing, and we don't want to find ourselves regretting not acting expeditiously down the road.
Agreed.
Thank you.
Any other comments, questions? Has Cattaraugus County approved their portion? Yeah,
They're in the process.
same
also.
process as
Yeah.
us. Okay. All those in favor, please say aye.
Aye.
Opposed? Carried. Thank you. Next proposed resolution is amend 2023 budget for tenant work for jury room alterations in the Chautauqua County Courthouse.
Good morning. Josh Rothwell, Assistant Deputy Director, Public Facilities, Buildings and Grounds.
Morning.
This is just a transfer of funds. The state courts leases space on the second floor here in the GOB. They added an additional clerk to their staff. Needed to create another office space. The state budgets for the work, and then it ends up in an account. And then this is just putting that into a county GL account so we can pay the contractor. The work's already been completed, and it's just approximately 12 foot by 8 foot section that they sectioned off in the jury assembly room on the second floor.
Questions, comments?
Budget neutral.
Budget neutral. That's good. Unified Courts has good about picking up their costs and expenses. So all those in favor, please say aye.
Aye.
Opposed? Carried. Thank you. Next proposed resolution is to adjust the capital project accounts road machinery. Did I skip one?
Yeah, you did. Yeah.
Four.
Skip 4.
I did that up. No. Sorry, we'll back up. Proposed resolution number 4 is the amend the 2023 budget to implement the Jurassic Office Building carpet tiles project using funding for the American Rescue Plan Act.
This is also a project here in the GOB, and it's just to continue the carpeting that we have here. We took the red runners off of the hallways due to trip hazards. There have been a couple people have tripped and fell. So first project was to do what we have, what you see on the floors here, and then this is just to button up the rest of it in the hallways.
It all looks nice. Nurses say the number one trip hazard is rugs in elderly homes. Not that we're elderly here, but anyone. And then over time, a corner gets curled up a little bit or anything, and so anything to help mitigate that, or wet floor stuff. And carpet technologies come a long ways. Obviously, you don't ever want to do that with certain things because of salt, and it just gets tracked all over the place and makes a mess. But hopefully they clean good too.
Yeah, a little bit more about the project. We actually, versus using adhesive, use tactiles to put that down because they're beautiful floors. Those floors are really, really nice. The finish on them and, labor and stuff that went into putting them there. So if ever down the road there was a different product or something else, years down the road, we could take that off without there's no damage to the floor underneath it. So
Nice. Questions?
So will this project be done by the end of the year?
yes,
Good.
It's good use of ARPA funds, good project for some building maintenance too. So all those in favor, please say aye.
Aye.
Opposed? Carried. Thank you.
thank you.
Now I think we can come to this resolution. Adjust capital project accounts for road machinery.
I can start, but this is a transfer of funds. We did the Sheridan shop fuel system. And basically this is money that was left over that we are going to transfer to the Sherman fuel station project.
Yeah, just to continue what Tim said is we had a project with the Sheridan shop fuel system that was based off of a compliance review from the DEC. That work was completed and did not need to be as far in depth as far as scope and expense. So that's where we want to close that project and move that money to the Sherman fuel project, which when bid, the low bid came in just over what we had budgeted. So this transfer will allow us to proceed with the Sherman fuel project.
What's been the holdup for this project? Was dated 2017. Is it just been waiting on certain things, or is it?
Well, we have bid it out a couple times and we redesigned it at least once based off of initial bids. That was the recent holdup over the last few years, is trying to see if we can't save money. But the prices, what we're finding is the prices are just what they are. They're just gone up so much over the last few years that, the changes we were trying to make in location and seeing if we can reuse existing infrastructure weren't enough to get over the hurdle of the cost we were seeing. So.
Do you know the project total cost? Obviously, you're asking for 55,865 in addition.
Yeah.
What is the total cost? Just so for
The low bid is just under 550,000.
and that's for a new fueling system.
Above ground tanks.
Yes,
Above
with above
ground.
ground tanks.
And some of that work we're going to do in-house too.
Mhm. I know fueling systems are expensive and they can become atrocious to maintain over the years. And I'm sure that you're replacing that over there because it's worn out and surpassed its functionality and service. So, and then I've asked the question before about, a more centralized location, but you need that over there, especially for winter fueling and stuff. So it's important infrastructure.
Yeah. Yeah. The existing system has underground tanks and we're pushing the life expectancy of those tanks. And with them being underground, run the risk of if we have a leak, it could lead to additional problems that, we don't want to undertake. And with the above ground tank system, the inspection and maintenance of that is easier. It's more of just a visual check. And if a spill were to occur, containment is a little easier of a task versus being underground where you need special certification to inspect that system. It's not needed with the above ground. So.
A rough life expectancy.
20 to 30 years.
Okay.
Well maintained, you can go beyond 30 and beyond.
Maintain it.
Yeah, exactly.
So will the Sherman, the fuel system, will that be done this year?
No, the tank will take probably a year to get.
Okay.
Everything else will probably be installed by spring, we'll just be waiting on the tank.
Any other questions, comments? All those in favor, please say aye.
Aye.
Opposed? Carried. Next proposed resolution, authorize agreement for purchase and removal of county-owned timber from this Dinsbrier landfill property on Dinsbrier Road in the town of Chautauqua.
This is part of the county reforestation plan. Our forestation consultant highlighted this property as being ready to be harvested for timber. So marked out the selected trees, put it out for bid, and we received 2 bids, I believe, and the highest bid was $111,570. And so this resolution would be to accept that bid and get the timber harvest underway. And then that revenue would go into the capital reserve for the Parks Department.
Do you feel this is a good time to be harvesting it? I know the market is poor, but have you?
Based on what our consultant has told us, this was a good price based on the current market. This was a good deal, and advised this would be a good one to go forward with.
Questions, comments?
I'm good.
All those in favor, please say aye.
Aye.
Opposed? Carried.
Thank you.
Next proposed resolution, quitclaim deeds.
Good morning, Kim Mullane, Director of Real Property.
Good morning.
So this morning we have one deed in front of you today. It happened to sell at auction. And then we found out that the current owner living in the property purchased the property in February with a guarantee that all the taxes had been paid, and they had not been. It was a mistake on behalf of the attorney of the previous owner. So we have decided to pull it from the auction, let the attorney pay for all the back taxes and the recording fees, and put it into the current owner's name instead. So that is why you have a quit claim deed in front of you today.
Well, I'm appreciative of mistakes happen. So I'm thankful that you are at least considering giving this attorney a break. The purchaser is okay with the reasoning of not being able to purchase it?
Not really, but there's nothing they could really do about that,
Yeah.
So, and we did refund them everything in full, their auctioneer fee and everything. So they got a full refund.
Okay. Did they buy any other properties?
That I'm not sure of.
Well, mistakes happen. We're all human.
Correct.
Next time for the lawyer, though, it might not go as well, right? We'll keep track.
There were 2 this year with him.
Well,
One we caught earlier.
okay. Well, so we'll keep track of that pattern.
Yeah.
Maybe if you get caught on one that you're not so nice on, if it's a common occurring mistake. Any other questions,
No, I'm
comments?
good.
All those in favor, please say aye.
Aye.
Opposed? Carried. Thank you. Next proposed resolution is authorized agreement with Town of Hanover for enhanced police protective services fiscal year 24.
Good morning,
Good morning.
Sheriff Jim Quattrone. This resolution is for a renewal of the contract and enhanced police protection with the town of Hanover, which also encompasses the village of Silver Creek for the year 2024. At that amount not to exceed $626,513.
pretty straightforward. This is every year, and they've been doing this for quite a long time, huh?
They have been doing it. They've switched for a while. Silver Creek had the contract and worked out a deal with Hanover
Mm-hmm.
a couple years ago. They switched that, and Hanover started with a contract, and Silver Creek worked out a deal, so they would have coverage going through the entire town. So it also encompasses Forestville as well.
And so this really it really designates how many officers into that area.
So our county, we split it up into 4 different zones,
Mhm.
and each zone has 5 to 7 townships. But the enhanced police protection allows to have 1 car assigned just to the town of Hanover. So we always have a car in that town. For some years, they would have an additional coverage in the summertime, part-time coverage to work Sunset Bay. They haven't done that for a couple of years.
24 hours, so
20
2 shifts.
It's 3 shifts,
3 shifts.
24/7.
Okay.
6 deputies.
Pardon me? Oh, 6 deputies.
6
Yeah.
deputies.
Oh.
6
To
deputies.
cover
I was getting
the
coached in the
officer,
back
I
there,
guess.
but
I'm
it's
sorry.
yeah.
Mr. Chairman, yesterday at the Public Safety Committee meeting, the sheriff explained that this contract has seen an increase in cost to the municipality. Number one, because of inflation, and number two, because we are moving closer to covering the county's total costs for this. So Sheriff, if you'd like to add anything to that.
Sure. About 4 years ago, we sent them a spreadsheet indicating every year what we were going to charge. We didn't want to add it all at once.
Yes.
We were, for many years, we were charging as a county a step 1 deputy, and that's not even possible because step 1 deputies not assigned there. They're not done training yet. So we wanted to, we've averaged steps 1 through 4 and go across the board. So we don't charge by the deputy. We do an average of what that rate would be. So it doesn't take into account, we may have a deputy up there that's at a higher step at different times, but for record keeping and ease of being able to have some sort of staffing issues there, we just have done the average. Quite honestly, this year we did not have all the raises calculated into there because 4 years ago, when we sent the spreadsheet to them, we didn't put that in there. And I wanted to honor what we had told them it would be. And then 2 months ago, I went to their board meeting with a spreadsheet so they knew what the cost was going to be for this year. But we still haven't heard from them. So, the goal is to get this passed through the legislature and ask legal to send the contract to the town. So we know whether we're going to have a contract for 2024.
Just to comment, years ago, every town had their own town police department. I'm sure over the years that they had one, and then consolidation took place, and the sheriffs cover it. But they want to have that. I know because other townships have the enhanced police protection service for the years, and there's other towns that take part in that, not to this magnitude.
Right. They used to have a town of Hanover, and that was dissolved when Sheriff Bentley was the sheriff. And they also had a Village of Silver Creek Police Department, which was dissolved, and contracts were done during the Sheriff Gerasi's tenure. So over the years, they've merged those two. For a while, we had 2 cars up there every shift. But over the last couple of years, they've gone down to 1 car.
I'm sure there's a line of enhanced protection and normal protection, and I'm sure that's why the county's been okay with charging them what they did.
Yeah,
but it is
every other
more
township,
realistic.
like, as I mentioned, we have a zone. So one car is assigned to 5 to 7 townships. So the response time may be a little longer. With the enhanced police protection, they have a car that is there dedicated to the town of Hanover.
Is this pretty customary in other counties across the state? I mean,
Various different counties have it. I can't say every county. I know Erie County does some. There's several other counties that I'm aware of that do this. I don't know if every county does it or not.
Good.
Questions, comments? Thank you for your explanation.
Thank you.
All those in favor, please say aye.
Aye.
Opposed? Carried. Thank you.
Thank you.
Next proposed resolution is the amendment of 2023 Emergency Services Budget for fiscal year 2019 Hazard Materials Grant Program.
Noel Gutman, Director of Emergency Services.
Morning, Bonnie Peters, Principal Account Clerk, Emergency Services. Before you is a resolution to amend our contract to bring in the remaining monies for a grant. This will be the final amount for that grant.
Questions, comments? Is there a new grant doing this work, or is this now being assumed by the department, or is the work being eliminated?
This grant was for equipment. This is a grant that we share with Cattaraugus and I believe it's Allegheny County. And we used it to purchase a drone for each one of those counties. So this just clears it up. It was the monies had to be spent by the ending of August. So this just takes care of that final amount.
This grant is generally used for equipment or training. And just last week, we got the applications for the new upcoming grant. So that more will be forthcoming with that.
No one will be coming. Good.
Yeah.
Okay. Questions, comments? All those in favor, please say aye.
Aye.
Opposed? Carried. How's it fly?
Don't know yet.
Next proposed resolution, amend the 2023 emergency services budget for fiscal year 2020 SHSP grant expenses.
So this is a grant that completes in February of next year, but we found that we needed some of the equipment items in this year. So we had not originally put it into our budget for 23. This brings it into our budget so we can use those expenditures and add the revenue into the budget as well as the expenses.
Questions, comments? Good. Pretty straightforward. All those in favor, please say aye.
Aye.
Opposed? Carried. Thank you.
Thank you.
Next proposed resolution is authorize acceptance of aging and disability vaccination collaborative funding for Chautauqua County.
Hi, Dr. Marianne Spanos, Director of Chautauqua County Office for the Aging Services.
Good morning, Dana Corwin, Deputy Director, Office for Aging Services.
So I wanted to start off by saying, I appreciate the comments from the lady who came to talk about this morning. I think we forget about the health disparities for minorities and low-income individuals. They have much higher rate of disease, and one of the main reasons is health education, which is what this grant is all about. Health education, being able to take education about the safety of vaccines. We all know during COVID, there was a lot of misunderstanding about vaccines and their safety and the diseases that they have eradicated in our country. As a physical therapist, I worked with a lot of people over the years who had been not died by polio, but were devastated by the deformities, the long-term health effects of polio. We all know that German measles sterilized a lot of men who had that disease, but that's been almost eradicated by vaccines. Rubella caused many birth defects. So there's a lot of misinformation, and I think knowledge, unless you're in the healthcare field or the biological field, studies field, you don't realize that people have forgotten the devastation of smallpox and so many other diseases that we've almost eradicated from our society. So this is really to educate and, yes, incentivize if that's needed.
And can I make it
Sure.
doesn't say coerce in there anywhere, does it?
No.
Okay. So it is an incentive, right?
Right.
And people still have a choice to accept the incentive or not and to move forward, right? And I think that's the clarity. I understand some of the logistics behind it, but it doesn't say coercion, right?
Right. And if you don't accept this money, another community will. It's already been allocated for this purpose from the federal government. It's not coming out of our state coffers. If we don't accept it, it will go to another community in the United States.
So when the young lady talked about gift cards, and so that is the incentive. You come in, you get your shot, and you get a gift card to where?
We haven't decided that yet. So we're looking for your, but we were trying to keep it local and something that makes health sense, you know.
Healthy choices.
Healthy choices,
Perfect.
so Tops or Wegmans or somebody said a gas card. I mean, the cost of gas has gotten very high. So
But
we're
not
open.
Cigarettes, alcohol.
I don't know if any of those places sell those things.
Okay.
So I don't know if we could limit that. I'm not going to give them an Amazon gift card. Or cash.
But that'll be on top of your list to make sure that they wouldn't be abused, those cards, I'm sure.
As I said, yes, of course. We want to try to, as much as we can, incentivize healthy choices and something that is helpful for their life.
Yeah.
People are telling us they don't have money to buy food.
Right.
And that their SNAP benefits, which were reduced after the COVID emergency passed, have significantly
reduced.
Yeah. Oh, yeah. Everybody was getting the highest amount for almost 2.5 years, and now, which is like 200 and something, and that's all being reevaluated.
And again, I appreciate the comments and the general public's input, but I do want to remind you also that the grant monies are not just focused on that. They're focused on outreach and education, as Marianne said, and removing some of the barriers for people that are older and disabled and might have many health disparities. So it also can deal with transportation. It can also deal with scheduling. It can also provide language assistance. So any of these things that historically have been barriers for people understanding and making a choice, having that ability to make that choice with health information, this will aid that. And it will also provide an opportunity for people to come closer to home and again, make it easier for them if they make that choice to go ahead and get vaccinated with flu and COVID.
So it's both flu and COVID. Okay.
And really, the timeline is pretty short. What
It's
if you don't
very
spend
short.
the money in this amount of time? It is a short period.
It is.
But
And a big goal.
it is a big goal.
It is
so.
a big goal. That question, I don't think we can answer this morning. We've just had our first kind of pre-planning call with US Aging and ACL. And so yesterday, before we presented, we had some questions answered. We're actually encouraging many vaccinations, including flu and COVID, which are the only ones that kind of count towards the goal. But we're also encouraging shingles and pneumonia. Thank you.
And RSV.
Mhm.
RSV is one of those diseases that, traditionally was only affecting young children. And now we're seeing a huge amount of RSV in the older adult population, again, with hospitalizations, deaths, from that disease that before this was not really seen in the older adult population. And
Questions, comments?
I'm good.
I'm good.
Mr. Chairman, may I add
Please.
an additional comment as a partner with the Office of Aging Services?
I appreciate that.
Come on forward so they can hear you. Obviously, we do have people that listen to the meetings that aren't present, and it is good to be able to have that on record. Slide up a chair.
Good morning, Dr. Mike Falk, Chautauqua County's Chief Medical Officer and Interim Public Health Director. I would like to start by saying that our department has been working collaboratively with the Office for Aging Services on this project. Our nurses will be an instrumental part of providing these vaccinations. The other perspective that I want to give to this is that the burden on the U.S. healthcare system when it comes to pneumonia is tremendous. It is estimated that 4.9 million people, Americans, every year will utilize the healthcare system in some way, whether it be an outpatient office, an emergency department, or a hospital, to the tune of about $13.4 billion. It is very clear that since even just looking at pneumococcal vaccine for pneumonia, which pneumonia disproportionately affects the very, very young and those over age 65. The data is very clear that pneumococcal vaccine lowers the rate of hospitalization and healthcare costs for us as taxpayers in the United States. Remembering that the vast majority of 65 years of age or older individuals will utilize Medicare. So that is a significant amount of money. So while these initiatives do cost some money, our hope is that they save even more money when it comes to the healthcare expenditures across the country. Pneumonia is caused by three different things, right? A bacteria, a virus, and some very small amounts of fungal. What we're talking about here are essentially three different vaccines that prevent pneumonia. Number one, the pneumococcal vaccination, which is what a large number of age 65 and greater offered by their primary care provider. Influenza hospitalizes people every year, and COVID. These are three vaccinations that can prevent hospitalizations, prevent death, and lower healthcare costs overall in this country. So we stand by this as a health department. And I would like to just, throw this out there that the dictionary definition of coercion is practice of persuading somebody to do something by using force or threats. And by no means are we doing that. So thank you.
So are these vaccines, whether it be age or income driven, or they're just open to anyone that gives you a call and says, hey, can I get a?
They're open to anyone. What we're supposed to be targeting our education to low-income minorities. So we're working with senior housing, we're working with the IDEA Coalition, we're working with health department, we're working with mental health, we're working with the Chautauqua Center, and really other partners are emerging as we continue our talks. But we didn't want to get too far down until we had your approval on the vaccine grant.
Mr. Chairman, I'd like to thank the staff of the Office for the Aging for their initiative in trying to secure this funding and help this population. And I'd further like to thank Dr. Falk for his excellent explanation and clarification of information this morning. Thank you.
Yes, I agree with Chairman Shagnon that it is important that we discuss these types of proposals. And we want to make sure that we're making the correct decision for our communities and accepting the right funds. And I think it is clear that you know, we're trying to fight that effort. And I do understand that the healthcare costs, if someone is like, doesn't take those preventative measures, it will maybe help ease the burden. So thank you for that correlation between that. And if we can help that, you know, it's good.
One hospitalization for pneumonia costs an average of $10,900. One hospitalization.
So, yeah.
Right. Just to give it a little different perspective.
If we can incentivize one person, we paid for it, you know, and that's the math. That's the math. So, other questions, comments? Good. All those in favor, please say aye.
Aye.
Opposed? Carried. Thank you. Next proposed resolution is the Lake Erie Management Commission authorization to approve and fund projects.
Good morning, everyone.
Good morning.
I'm Dave McCoy. I'm the Chautauqua County Watershed Coordinator, and I work within the Office of Planning and Development. This proposed resolution is to help facilitate the LAMC be a little more effective. We've been doing a lot of projects in the last few years, and as a result, we're here in front of you almost monthly with our projects. That being said, each of those projects require a sign off by the county executive. This resolution is a blanket resolution that allows us to just go to the county executive with these, not have to come here.
Are you going to still tell us what they're doing?
Pardon
me? Are we still going to know what's going on?
Yes, we do.
Yeah. These are budgeted.
Yeah. Yeah, it's good to know. So I agree. It is easy just to have an overall blanket, and that makes sense because then you can act. Sometimes you need to act quickly on this stuff. So if you have an approval and you don't have to wait for a meeting, that's good. But it is also good to know what is going on and what those projects were. So,
yeah. And you know, when you think about it, you know, each resolution requires committee meetings.
Yeah.
Paper and administrative review. This makes a lot of sense.
Yep, certainly.
Mr. Chairman, as we discussed at the Planning and Economic Development Committee meeting last night, LAMC has a budget that the funds were allocated in the county budget. So anything that the county executive signs off on will, of course, be within the budget funds that are appropriated. Otherwise, they would need to come back to the legislature for additional funding. So all we're doing is permitting the LAMC to operate within their already approved budget. Makes a lot of sense.
Yep, agreed. Other questions, comments? All those in favor, please say aye.
Aye.
Opposed? Carried. Thank you for coming in today.
There's some maps for your funds.
Okay.
I already have one.
I have one too.
Next proposed resolution is titled the Environmental Assessment of Projects for 2024 2% Occupancy Tax Grant Program.
You know, this is an annual process. We were before you earlier this summer with 10 projects that we'd asked for the legislature's permission to do environmental review. That's been done. Each of these projects are relatively minor in scope and nature. They're not a type 1 action that requires a full-blown environmental review. They're not type 2 actions, which are generally maintenance or ministerial. They're in a category in the middle called unlisted actions. And all of them have been checked that way. Generally, they're stream bank stabilizations and stormwater improvements.
Well, it looks like you've put together a nice presentation so we can see what's going on and where they are. And for the record, everything is labeled nicely, so thank you.
This year, there are 5 in the Chautauqua Lake watershed and 5 up north in the Lake Erie watershed.
Questions, comments? Looks good, honey. All those in favor, please say aye.
Aye.
Opposed? Carried.
Thank you.
Thank you. Next off, proposed resolution is authorized clerk of the legislature to publish notices, public hearings on 2024 tentative budget and maximum salary of members of the Chautauqua County Legislature and its chairman.
Okay. Olivia Lee, Clerk of the Legislature. This is an annual resolution that is required by the county law that allows me to publish notice of the public hearing that will occur in October on the 2024 tentative budget and the maximum salary of members of the legislature.
And this is for year 2024.
Yeah.
Okay. Questions, comments?
Mr. Chairman, I'll just point out that perhaps the obvious, but these dollar amounts are the same as they have been for a long, long time.
And that's why I had asked the question. I know we are currently in a review process, and could this be altered at a different stage, or is this what it is moving forward for the next 2024 year?
This is what will be published for the budget. That doesn't mean that is what has to be adopted at the budget, and or it could be altered beyond the adoption of the budget. And you're correct, Mr. Chairman, that the Salary Review Commission is continuing to meet and review information with the excellent help of our Director of Human Resources. And that commission at this point expects to have a recommendation to the legislature by roughly, our target is December 1st, with the anticipation that any changes that are anticipated to the salary structure for elected officials, we would entertain after the new legislature is seated in January of next year.
Thank you for that update. That's kind of what I was trying to squeeze out of someone. I knew that they knew the information in the room. So
Sure.
Thank you.
Well, we were a bit up in the air when the initiative was underway to move the elections to even numbered years, not knowing at that time what the implications would be for all of the elected officials that were reviewing. But at this point, the legislation that is on the governor's desk for signature would not impact 2024. So the election schedules would not be pulled forward so that we would have to deal with potential salary changes in 2025. So the Salary Review Commission has a little bit more time to make its recommendation, which is good. And it gives us the opportunity for the new legislature that is seated on January 1 to consider any potential changes.
Any other questions or comments?
So, yeah.
I can see the marbles running. I'll give you the time.
That picture's not straight over there, but one of the things is, if I'm not mistaken, the county executive and maybe the sheriff have built-in mechanisms.
They get a cost of living increase each year. That was a charter change that was adopted several years ago. Yes. And Dave, the Salary Review Commission is looking at current salaries.
Right.
With the cost of living increases that have been put into effect over the last several years.
This is a tough subject in sense that, who as an elected official wants to set and give themselves raises, and that's probably why these numbers are old. But over time, it is accurate that we do make sure that it is correct. It also is to entice. We encourage people to want to run for office, and if it is a halfway decent. Obviously, if someone that's going to run for the seat is not doing it for a full-time position because it's not meant for that, it's for pay reasons, I suppose. But at least it ought to at least cover compensation for time that is involved in the duties. And so it's important that we look at this. I appreciate your thought of an annual raise of some sort, so that way it doesn't get lagged behind. Do you know that when these numbers were set? You said they've been on here a long time, 20 years?
We didn't review these numbers in particular because the Salary Review Commission is looking at the salaries, not these additional compensations. But it's been for a long time. But Jay Gould, who serves on the Salary Review Commission, believes that the legislator's salary has not been changed in, I think he said, 25 years, maybe. But bear in mind that the Salary Review Commission is also looking at the county executive, the county clerk, and the sheriff. Which are the elected positions that are their salary is under essentially local control.
If we can just keep that in the back of our mind, that some type of mechanism, I think, would be appreciative going forward for us, whether we're involved in it or not. So we wouldn't have to come back and visit this, and then we wouldn't have wages out of line for 20 years, whether it be something, some type of mechanism. We could think about that.
Dave, I can assure you that the Salary Review Commission has considered that, and I fully expect that that's going to be one of their recommendations. I can't speak for the commission, but I do sit in their meetings.
No, but I do believe it's a fair way to do things, and I didn't realize we were out of whack for that long. 15 to 20 years, that is a lot.
Yes.
Especially at today's price.
And no matter what the job is in front of us, it is our duty to correct this or make it correct.
Yeah.
And so that's what the hope is, and the commission is going to lead us in that direction. And also if we want to adjust it in any way we can too for see fit. So we'll have that as an open discussion, I'm sure, when they present. So.
Sure. And I will remind you that the Salary Review Commission is a bipartisan commission. We did that clearly intentionally to make sure, and the discussions around the table at the commission meetings have been very bipartisan, very constructive.
Yes, very important to make sure all that is correct. So we've, okay. Any other questions, comments? All those in favor, please say aye.
Aye.
Opposed? Carried. Thank you. So we do have a couple other orders of business. I kind of like keeping things similar in similar ways. So if it would be okay, I'd like to bring the couple late resolutions to the table at this time, if that would be all right.
Mm-hmm.
Then our resolutions are complete. The first resolution is titled Amend Chautauqua County Department of Mental Hygiene and Social Services 2023 budget for increased services for recipients' costs. Sam, you don't have an objection to bringing them forward now, do you?
I do not.
I didn't figure. I'd rather you be back to your office working. So thank you.
Yeah, thank you. Sam Zafoto, Fiscal Supervisor, Social Services in the Health Department. Yep, this resolution is bringing, basically, we've gone over a budget already in A6070 service for recipients. That is the non-TA domestic violence and also some foster care costs. So this is transferring some funds to keep it budget neutral and for us to continue on through the rest of this year.
Questions, comments?
I heard the magic word, so I'm good.
Budget neutral is always good, Sam.
Thank you, Sam.
All those in favor, please say aye.
Aye.
Opposed? Carried. Next resolution is titled Amend Chautauqua County Department of Mental Hygiene and Social Services 2023 Budget for Increased Emergency Aid for Adult Costs.
Yep, this is the account emergency aid. This is the spot where you'd have the emergency need for housing, utility payments, et cetera. We have gone over budget, and in this account, this is transferring some funds from Social Services Administration to cover this through the rest of the year. This is 50% covered by the state of New York. And this, again, will keep this budget neutral at this point.
And I remember from, for both resolutions, you have amended the upcoming budget for these new budget amounts.
Yes.
So we're up to date.
Yep, this actually had been reduced, emergency aid for adults to 75,000 in 20. And last year we went over budget at 120, so it has been increased in the 2024 budget.
Good. We want to be correct moving forward. So
I'm good.
all those in favor, please say aye.
Aye.
Opposed? Carried. Thank you.
Thank you.
I think that concludes our resolutions for today. We have a discussion item. It's a coroner update by Dr. Michael Falk. I'd like to encourage him to come down and proceed.
Just a second here, we can connect. Sam patiently waited a long time last night to present those two quick resolutions, so thanks. Sam's doing very extremely important work for us at the health department as well, so.
Well, that's what I figured. I might as well let him get back to work. He can present those. He doesn't need to listen to your presentation again.
Good morning again, Dr. Mike Falk, Chautauqua County Chief Medical Officer and Interim Public Health Director. And let's see if we can get this up and running here. Okay. As some of you recall, I presented an update on the corner program approximately 10 months ago or so on behalf of the previous administration, taking a look at some of the challenges that we've had with recruitment, retention, stability of the corner program. And those being for a variety of reasons. We've had the opportunity over the last 10 months or so to rethink this through, reprioritize, and still we realize that retention and stability of the program continues to be an issue. I'd like to provide an overview of where we are now and where we would like to see the program go. We are chartered for 6 corner positions. We have 5.5 corners. 2 of our corners are sort of half-time. We're extremely part-time. All 6 of our current coroners are nurses with a vast amount of experience in emergency medicine, primary care, a couple of them with extra training in forensics. One, Jen Wilcox, is our newest coroner, is a nurse practitioner. Ken Haley and Dan Tyler both have extensive administrative experience in hospital settings. Ruth Mendez is an RN from Puerto Rico who is currently trying to get her license in New York State. Amy Newhall is one of our newer coroners, is an emergency nurse and a stat medevac nurse. Desiree Vera, a longtime emergency nurse, hospice nurse, and one of our coroners. I will note that Ken Haley is our longest tenured coroner at a whopping 4 years. Most of them have been with us for less than a year and a half, which sort of tells us that, again, retention is a major problem, and partly because the work is difficult, the pay is not great, and there's a lot of time commitment. Our full-time coroners commit about 12 to 13 12-hour days per month to take call for the program, which means that they're able to kind of do their thing at home or at the store, but they have to remain in Chautauqua County and be ready to respond immediately to a coroner call. Their average pay is about $16,000 per year for taking up 12 to 13 12-hour days of their month. So again, between the nature of the work and the minimal amount of pay, we've had issues retaining coroners. Myself and Dr. Walters are our county's coroner physicians. We discuss most every case with our coroners, determine disposition of the decedent, whether it be funeral home, the medical examiner's office, and sign off on and certify the natural deaths for the most part within the county. We all know what a coroner is, but I want to emphasize what a coroner is not. A coroner is not someone who shows up to a death scene, puts the body in a body bag, and sends off to the funeral home. Our coroners have a lot of responsibilities. Pronouncing death, determining what time the death occurred, extensive scene investigations, of which even the sort of non-complicated case is a minimum of a 3-hour time commitment. Taking custody of the decedent, making positive identification of the deceased, identification and notification of next of kin, just signing off on and getting death certificates started, a lot of reports, communication with funeral home directors, communication with medical examiner's office, and the list goes on. The numbers of coroner cases are increasing over the last several years. This is in part to the ongoing opioid epidemic, and increased rates of suicide, and overall increased rates of medical complexity presenting to hospitals. Patients are just sicker with more advanced disease. And this is all contributing to the increasing numbers, 29% overall increase in coroner cases since 2019.
Do you know what the number of coroner cases were in 2015?
I don't know what the number were in 15. My guess is they're probably higher then. Yeah, PJ.
I just wanted to know that trend and have that on the
Yeah.
record because I have a.
So as I was chairman of the legislature, one of the things we looked at prior to that, to give you some historical perspective, the number of cases that we were attending were just about every death in Chautauqua County. Hospice deaths, hospital deaths, nursing homes, etc. As we revamped the coroner's program and the pay increased, we realized we did not have to attend as many deaths. So that's why the number you saw probably drastically has dropped since 2015. Those numbers were really high due to we were going to every case.
And that's what I wanted to bring to the table today so that it was on the record too. And do you know offhand, roughly, was it 300, 400 cases? I don't remember.
Much more than that.
600?
I wanted to say, don't quote me, but I think between 500 and 900 cases. Yes, it was astronomically higher.
So our original initiative did shave that number down significantly, but they are on the rise since then. Right. And that's the important thing that we want to make sure. I just wanted to bring out. So okay. The one does go back to 2017, but that's just the autopsy cases.
Autopsy cases, yeah. We are not responding to nursing home deaths. They are attended deaths. Hospice deaths are attended deaths. In-hospital deaths, unless they involve something suspicious, or they involve something that happened acutely in the emergency department, our coroners are not responding to those deaths at this time. Drug overdose deaths have obviously increased, 125% increase in drug overdose deaths since 2016. This year we're on track, again, similar numbers to last year. I will say, however, many other counties have seen a dramatic increase in deaths, even more so than this increase. And I do firmly believe, with all of the efforts with our community partners, our Office of Mental Hygiene, and all of those agencies, police agencies, EMS agencies that are utilizing harm reduction practices with things like Narcan, we are saving a lot of lives. And these numbers would be much, much higher if those efforts were not occurring in the community. So the challenges that we've had, again, retention of our coroners, minimal pay, 12 to 13 call days per month, the difficulty of work. One of the coroners that we hired or so last year lasted about a month or two and just said, hey, I can't do this. It's tough work. It's been exceedingly difficult to cover the weekday shifts, and partly because all of our coroners, with the exception of one, have other full-time jobs. One of our coroners is, for the most part, retired, but others have full-time jobs, and therefore it gets difficult to cover those daytime hours on the weekdays. So much so that I've had to pick up some of those shifts myself as a coroner's physician, functioning as a coroner on those weekdays that we cannot find coverage. And this is kind of where we start thinking about a request for change. The county has seen a significant increase in complex coroner cases. We're proposing that a full-time management position is needed for added program oversight, improved stability and structure, and the potential cost savings to the program, which we'll get to. The new position, the initial duty will be to respond to death investigations Monday through Friday, 8 to 4. 42% of the coroner calls occur Monday through Friday, 8 to 4, which means that we are paying our coroners $150 per case. So that money, therefore, will be then allocated to the individual that would be potentially serving in this role. They will also function as a supervisor, supervising the coroners and support staff. Yeah.
Question on that. The current staff is okay with that transition right there, as you're going to be essentially taking away 42% of the cases to our current.
Right. It is a conversation that has been held loosely over the last year.
Mm-hmm.
I think the majority of our coroners understand that we have been looking at a full-time coroner supervisor type of position. The implications of that haven't necessarily been fully discussed, but we are prepared to move in that direction. We have the opportunity to really look at the staffing structure and the framework of the program. And frankly, our most tenured coroners would have priority over the scheduling, and they would maintain their desired number of shifts for the most part. And again, we do have two individuals who are part-time and are just picking up shifts on an occasional basis. Okay. So we would essentially cater to those that have been there the longest and those that are committing to a full-time call schedule.
Thank you.
They will additionally be developing policies and protocols, assisting with program budgets, assisting with securing vendors, and communicating with our vendors holding contracts, such as the Erie County Medical Examiner's Office. Work collaboratively with other county agencies, such as the police agencies, the forensic investigation team, and also providing education, continuing education, certainly on safety practices and other types of education as well. So, the considerations here are we would not be paying case rate for about 40% of the cases. So, that $150 dollars per case would be applied to the costs of essentially as cost savings to this position. We also reallocated one public health nurse position that went unfilled for several years. So in our initial proposal that we sent to Human Resources, we were reallocating that already budgeted public health nurse salary and fringe to this new position. Okay. We also have the potential to send fewer cases for autopsy, I think. We'll get to that here in a minute. And also potential savings in decedent transport fees. Our autopsy cases run county taxpayers about $2,800 per case. Sometimes upwards of $3,500 per case. That does not include $475 that we contract out to transport a decedent to the Erie County Medical Examiner's Office. Our contract with Erie County Medical Examiner's Office for 2024 budget approaches $400,000. And that's for approximately 119 autopsies done by a board-certified forensic pathologist. And most of those cases we're sending for autopsy are suspicious deaths, pediatric deaths, suicides, drug overdoses, homicides, things like that. I think we have opportunities with a full-time person to advance the program and look for cases that we don't have to send to the medical examiner's office. We may feel more comfortable with taking care of some of the drug overdose cases ourselves here locally, but that would involve procuring some contracts with either hospitals or laboratories for toxicology services, which we don't have right now. There's wide variety of how different counties handle their coroner programs. Those shaded in blue are some of the ones that we were able to get a hold of and talk to. And you can see the annual pay per coroner is all over the place. These are for average coroners. We're on the far left there, Chautauqua County, average is $16,000. Some are higher, some are lower. We might be right in the middle of the pack there for our coroners.
Dr. Falk, do you believe that that coroner pay is hindering individuals from getting into the coroner occupation?
I think it's hindering retention. I think that this year, I think we've demonstrated that we've been able to recruit, but the problem has been retaining them. I think they realized that, I don't know that they realized fully initially how much time is involved in having to be on call and available. In each case, it takes up about 3 hours of their time on average. That's a simple case. However, there are cases, and we've had some of these cases over the last several months, where a coroner may be involved in a case for upwards of 10 to 12 hours. And that doesn't include whether or not they get called back in for court to testify as a witness in a homicide case, for example. Those are covered under their $6,000 a year stipend, those administrative duties. but they're not getting paid extra to do that kind of stuff. So I think once they kind of get in the program and they start realizing all of that, despite us sort of providing an appropriate orientation during their interview of what it's all about, until they're actually doing it, it's very difficult to get them to conceptualize what it's all about. So I think the retention part, I think, is the biggest issue. And I think with this position, having a full-time position, and I mentioned this yesterday, that the worst case scenario, if all of the other coroners said, you know what, I'm done, like, we're not going to do this anymore. And we have had that situation, I believe, in the past where all the coroners have walked off the job,
Yes,
to a certain extent. At the worst case scenario, this full-time coroner supervisor, myself and Dr. Walters could cover the coroner call schedule until we put something together. This is a mandated service. We can't go without it. And this provides that structure and stability.
And to be clear, really, currently you aren't asking for anything in for the coroners themselves, just in the sense of supervisor. Right. So,
right.
Be correct. Ask for what you need now versus next year and say we should have done it then. So
yeah, and I appreciate that, because last year, as you recall, we came in late at the end of last year, asking for approximately $115,000 to really increase all of the coroners' pay rates, case rates, and right now they're only eligible for single healthcare coverage, the way it is, and I think we were asking at that time for full family, the option of a family healthcare coverage. I was hesitant to proceed in that direction partly because I don't have a full understanding of what those sort of savings are going to be kind of moving forward into 2025 and 2026. If we are able to structure the program right and cut down on some of those contractual costs, and if the program is still sort of on a fragile sort of foundation, I would, certainly appreciate the opportunity to kind of shift some of those cost savings to increase the stability of the program even further with the other coroners.
That can be in the job description.
Mm-hmm. Yeah, right. Yeah.
Right. Make sure that happens.
Yeah.
But it seems like compensation and retention have been a problem in the coroner's office for some time.
Yes.
This is an opportunity to change that.
Yeah.
With a new management style and more money. I don't like to spend more money, but I'm just saying.
Understood, and that's why I mean we know it's an issue, and that's right. I appreciate the thought of also you want to see how things roll out, but also it's another year that you're struggling to once someone's been a coroner too, they're going to say, well, I've been down that road. I don't want to go down that road again. So your pool's getting smaller. Maybe if with the pay increase, some of those that did quit before would say, well, it's worth it a little more now because there is a little more money. But I think that retention portion is key.
Yeah.
And it's not fair or correct for others to be filling voids because of, I don't want to say mismanagement, but in a sense, that's what it would be in a sense if you can't keep the position filled, right? So
we've done the same thing for other positions in the county. Everybody has the same problem, retention and pay. So we've done a lot of that for the unions, and I think that we'd be open for that.
Okay. Well, I appreciate that, and I know that our coroners would appreciate that too. We cannot keep hiring new coroners every 2 or 3 years. It's just not sustainable. There's a lot of training that goes into this. There's a lot of liability on the county. We need accurate death reporting. We do not want to be missing a homicide, right? We need coroners that are well trained, know what they're doing, have a solid foundation of pathophysiology, disease process, which is partly why we are now employing all medical professionals within our coroner program. But the only way we're going to do that is, as you say, be able to bump that up a little bit. That salary range for that that position, it's a range from like $3,000 up to $15,000 for that stipend. So we do have some room in that salary range if we went that direction. And so we appreciate that.
Mr. Chairman, I'd just like to make a comment that I think we've been struggling with the coroners program for the 10 years that I've been a legislator, and probably for many years before that. We've tried throwing money at it, and it really hasn't solved the issues. I really appreciate the tack that Dr. Walter is taking to try and address some of the inherent problems with the coroners program, and his recommendation will add structure and stability to the coroners program that we have never had. And I think that that's a foundational piece of what he's proposing that has the opportunity to really make a significant improvement in the coroners program. And I also appreciate the fact that he wants to be a little cautious in seeing how this rolls out, rather than just declaring what the benefits are going to be and taking actions immediately. I kind of like the wait and see attitude of let's put this structure in place, wait a few months and see how it's proceeding, and then decide what future courses of action are appropriate. I think that this is the best thing that I've heard about the coroners program, other than when the legislature turned it over to the health department. But I certainly appreciate the time and effort that Dr. Walter is putting into this. And I think that we are on the cusp of a major improvement to the coroners program.
Thank you for that. And I'd like to add to that, since years ago, the legislature was aware that it was the coroners program needed to be managed.
Yes.
And so, and since we took our responsibilities from that and gave it to a department head as a manager. And so, and we're, as time has come on, it has been a few years, it's been 5-6 years since that's happened. And we're seeing how it has turned into things. And I agree that it is important that I think that it needs a manager. PJ.
Yeah, just some clarification. This project that Dr. Falk has been explaining was something that was brought up prior to COVID. Then Public Health Director Christine Schuyler was going down this road of looking at a manager and a structure she was establishing. But with some turnover, then with COVID, it really got sidetracked. So I'd like to thank Dr. Falk for picking this up and moving forward with it. This is something we had discussed previously. I think it's a very sound move going forward. And like you said, I think it works quite a bit to our recruiting and retention efforts. That, as we said, we've had a lot of turnover, but in the case, some of our coroners now have left and come back. So we're very confident that knowledge will help us in the future. But this is a good step. I really appreciate the efforts they're making.
One last slide. So what's the bottom line here? Remember, this is not going to be an extra corner. This is not going to be the 7th corner. So, that average salary of $16,000 would obviously be applied to this individual. Keeping in mind also that we reallocated that RN, public health RN position that was already budgeted for. We do receive state aid, full disclosure, for public health nurse. So really that's about a $40,000 figure that we would apply to this position. $23,700 would be the anticipated case rate. And then we're, the last 2 bullet points, the $40,000, we're estimating conservatively, and that's more of an eventual savings, 2025, 2026, once we get some stability with this individual, we may be able to reduce those potential cost to the medical examiner's fees. Again, it's, can we get, maybe can we identify 15 or 20 cases that we do not have to send up to the medical examiner's office to recoup some of those fees? I think we can. And then we've also, and this is a different conversation, the transportation fees. We're paying now $475 per case to transport to Buffalo. It clearly makes sense to me that if we had a vehicle lease and did our own transports, it would, at the very, very minimum, it would break even. If we had our coroners doing the transportation. But we may be able to recoup a few $1,000 every year. So, and we have, a potential need for a vehicle, anyways within the program, but that may also make sense. So I think, although this is going to reflect an increase in the budget for the coroner program, when it comes time to look at all of this, across the budget for the public health department, we're going to be, not really looking at a tremendous extra cost here.
So, questions, comments?
Nope, I think we've had a good conversation.
I reserved some of my questions last night. We were short of time.
Oh, okay.
As you can see.
It's okay.
So you had them today. Any other questions, comments? So thank you for presenting, and continue working on this. It's a work in progress. So budget season's coming up, so we'll be anxious to see what it all looks like. So
I did mention last night we may be asking for a little more of your time come November, December to talk about some strategies with our opioid settlement funds and what mental hygiene and health department have in mind to proceed further with that come 2024. So
potential
stay tuned.
cost savings for coroners program, hopefully.
Yeah, that is very true. That is right. You got it.
Any other business that anyone would like to bring under other?
Are you coming, Kate?
Yeah, I thought I should mention, I'll be Kitty Crow, Director of Finance. I just wanted to let you know, we have caught up the investment reports. I just need to send them out to you. As I mentioned in earlier this year, they would be kind of delayed because Todd was out for a while. When he came back on board, he was really focused on our audit, but he has since caught us up. And so those regular monthly reports should resume here shortly. So I just wanted to give you an update on that. I would probably, the November meeting would be a good meeting for me to give an update on the investment portfolio and review the policy with you. I would do it next month, but I think there'll be a lot of other things we'll be doing next month. So we can plan for that in November.
Yeah, and I think it's important, those figures will be known during our budget time.
Mm-hmm.
So, as long as we knew those numbers moving forward too for projections. So,
yeah.
Good.
Okay. Thanks.
Thank you.
Yep.
Any other? If not, I'd entertain a motion to adjourn.
I'll make that motion.
I'll second that motion.
All those in favor, please say aye.
Aye.
Opposed? Carried. I want to thank Pierre for joining our meeting today as a voting member.
Happy to serve.